Now we'll be talking about four different types of hospitals that you could find around the communities or the towns and the cities. So this is a pediatric hospital. We'll talk about what a pediatric hospital does. We also have a veteran hospital. We'll talk about what a veteran hospital does. We have the psychiatric hospital. We'll also talk about what a psychiatric hospital does. Then we'll also talk about the long-term care facilities. Okay, so these four type of hospitals or medical facilities, we'll talk about their uses. So for pediatric hospitals, they mainly care for what? Newborns, that's children that were born and they're still within the first 28 days of life. They care for children, they care for adolescents. So you have all those specialized pediatric surgeries, neonatal intensive care units, child-focused diagnostic imaging, pediatric oncology. They also attend to heart-related issues in children. So the environment is usually child-friendly. They draw all those cartoons on the wall and all of that, you know. So about the Veterans Hospital, it's mainly for military people. So they target and they have compiled some common problems that people that have gone into military usually face. And these hospitals, they basically target this. So they give general medical care, rehabilitation, mental health services, prosthetics, and treatment of service-related conditions. They are often run by the government because the government could actually attend to military guys free. You understand? Then we have the psychiatric hospitals, which is basically treatment of mental health disorders. Okay, inpatient psychiatric care, therapies, medication management, crisis intervention, rehabilitation programs. The environment is basically a secure facility with specialized staffs. So people that say that if you do psychiatric, you mostly even be behaving like them. That's the funniest part. Okay, so long-term care facilities is basically to care for patients for a very long time. Those patients can't really do things on their own, and for a very long time you have to be coming through for them. So mainly elderly people, individuals with disability, or those needing ongoing medical support. So continuously they need attention. All right, so for these different types of hospitals, this is what we got. I'll still pick some other types and I'll still talk about them.